This mobile application and the videos contained within it has been produced through a collaboration between Children's National Hospital, the George Washington University School of Public Health, and the National Urea Cycle Disorders Foundation, with funding from the Patient-Centered Outcomes Research Institute and support from the Urea Cycle Disorders Consortium. Our goal is to educate patients, families, and healthcare professionals about the treatment options of urea cycle disorders, including treatment with diet and medicines and liver transplantation. We have put together a series of 3 videos on this topic. This first video will describe urea cycle disorders, talk about the effects of high ammonia, discuss the treatment options of diet and medicines or liver transplant, and introduce our completed 2-part research study. The next video will cover the part of our research study that looked at the factors that people consider when deciding whether or not to choose liver transplant. The last video will talk about the part of our research study that compared outcomes in a large group of patients with severe urea cycle disorders, some of whom were treated their whole life with diet and medicines, and some who got a liver transplant. What is a urea cycle disorder? Well, first, we need to talk about what is the urea cycle. When you eat protein in foods, one of the waste products is ammonia. A process in your liver called the urea cycle changes waste ammonia into urea. The urea cycle has 6 steps needed to make urea from ammonia, and each step is performed by something called an enzyme. Think of the urea cycle as a factory inside the liver. Each enzyme is represented by a person working on an assembly line who has a specific job to do. If one person on the assembly line isn't doing their job, or in other words, if one enzyme doesn't work, then the ammonia can't be made into urea. This can cause a buildup of ammonia. When one of the urea cycle enzymes in someone isn't working, they have a urea cycle disorder. Urea cycle disorders are very rare. About 1 in every 35,000 people has a urea cycle disorder. But not all urea cycle disorders are the same. In fact, there are 2 major groups of urea cycle disorders. The first is called neonatal onset, and the second is called late onset. Neonatal onset means that without treatment, high ammonia and symptoms start in the first month of life. On the other hand, late onset means that without treatment, high ammonia and symptoms start after the first month of life. In the neonatal onset type, one of the enzymes is missing. In this case, no ammonia can be made into urea, and it starts to build up. Just imagine what would happen if one of the specialized workers on an assembly line didn't show up for work. Nothing could be made, and materials would build up. In the late onset disorders, one of the enzymes doesn't work as well. It's there, but it just works much slower. This means only some of the ammonia is made into urea, but some of it isn't, and it starts to build up. Just imagine if one of the workers on the assembly line was working very slowly because they were tired. Products would still be made slowly, but raw materials would still build up. As a general rule, patients with neonatal onset disorders tend to be more sick, and their ammonia levels are often higher. Why is a high ammonia level bad? High ammonia levels can lead to brain swelling and brain damage. What are some of the symptoms of a high ammonia level? These include poor feeding or vomiting, irritability or changes in behavior, fast breathing, seizures, drowsiness that leads to lethargy, and then to coma. And if the high ammonia level and these symptoms are not treated, this might also lead to death. Even if high ammonia levels are treated right away, there can be some long-term effects, like slower development, worse attention, and slower decision-making. Because of all these bad effects of ammonia, treatment is important. So how do we treat urea cycle disorders? There are 2 major treatment options. One treatment option involves diet and medicines. Because ammonia comes from protein, most patients work with their dietitians and doctors to eat only a small amount of protein every day, also called a low-protein diet. Sometimes that means drinking a special medical formula every day. Patients may also be prescribed medicines that help get rid of ammonia. Both a special low-protein diet and the medications will need to be continued for a patient's whole life. Frequent medical visits may be needed to adjust the medicine dose and the amount of protein in the diet to make sure that a patient is receiving enough to grow, but not enough to cause high ammonia levels. But sometimes, this still isn't enough to keep ammonia levels low, and even with the best diet and medicines, patients may still get high ammonia levels and need to be hospitalized for treatment. Even with the best treatment, patients may still have brain damage or die from high ammonia levels. Another treatment for urea cycle disorders is liver transplant. The patient's liver with a urea cycle that doesn't work will be replaced with a liver from another person. This new liver will have a working urea cycle that can process ammonia. The new liver can come from a living person or a person who recently passed away and generously donated their healthy organs to others. Livers can be transplanted whole, or only a part of a liver can be transplanted, also called a split liver. There are some risks with liver transplant. Patients with liver transplant can have complications from the surgery, and a small number can die from the surgery. Patients with liver transplant also need to take special medicines. Although patients with liver transplant don't need to be on a low-protein diet or take typical UCD medicines, they do need to take other special medicines to prevent the immune system from attacking the new liver. These medicines may need to be taken for a patient's whole life. Sometimes there are problems with a new liver, and in rare cases, a second transplant is needed. Even though these are the two major treatments for urea cycle disorders, there isn't much information comparing these two treatments. There have been many researchers trying to answer this question. Most of these research studies included only a small number of patients. Some studies have shown some benefit to liver transplant, but other studies have shown no difference. The two biggest studies with results published in 2021 were from Japan and Europe. Doctors treating patients with urea cycle disorders were sent surveys and asked to send in information regarding the treatment of their patients with urea cycle disorders, as well as their outcomes. Both of these research studies showed that liver transplant prevents further high ammonia levels, but did not show any difference in survival or brain functioning after the transplant. These two studies were well done and add to our understanding, but these research studies may not provide the full picture because they depended on healthcare providers to respond to the survey. Also, both the treatments as well as the access to liver transplant is different in Europe and Japan than it is in the US and Canada. So, to get a better understanding of the outcomes of patients with urea cycle disorders, we decided to study liver transplant and medical management in the largest group of UCD patients in the United States and Canada. There were two major parts to our research study. The first part was to learn how people make decisions about whether or not to choose liver transplant by interviewing caregivers, such as parents, and healthcare professionals, such as doctors and dietitians, of UCD patients. The second part of our study was to compare survival, quality of life, and brain functioning in a large group of US and Canadian patients with urea cycle disorders, some of whom had liver transplant and some who were still treated with medicines and diet. We want to share the results of our study with you. You can hear more about our study in our next video, in which we talk about how people make decisions about whether or not to choose liver transplant.